Would you accept the blood of a dead person to save your own life? In 1930, Soviet Russia, a young man lay in a hospital bed, bleeding to death. In the next room, another man had died 6 hours earlier. To save a man's life, doctors would transfuse the blood of the dead to the living. This is the story of how the Soviets began harvesting blood from cadavers and in doing so, created the world's first blood bank. In Blood Stories, Soviet Cadaver Blood. In 1927, Dr. V.N. Shamov had started experimenting with dogs. And a warning, the upcoming part of this story is at least 4 times as sad as the dog scene from I Am Legend. Shamov took canine cadavers he had killed hours earlier and transfused their blood into live dogs, whom he'd bled to near death. Shamov would take the blood from the deceased dogs at regular intervals, up to 12 days after being put down, and transfuse the blood into his barely alive test subjects. By using this technique, Shamov was able to deduce that blood most distal from the gut remained sterile and its oxygen carrying capacity remained intact. He found that those dogs who received blood up to 10 hours old were able to be transfused without issue and make a recovery. Shamov spruiked his findings at conferences, where another doctor by the name of Sevi Yudin heard his lecture. On hearing these canine findings, Dr. Yudin thought this could be the answer to a problem he'd been trying to solve: how to stop thousands of trauma victims who pass through his emergency department every year dying from hemorrhage. At the time, blood banks were a novel idea and yet to be implemented anywhere within the world. Blood donation up until that point was done on the hoof, a term which meant a compatible donor would be called up as needed. These donors were often volunteers on a registrar and pre-screened for diseases such as syphilis and malaria. However, sometimes it was just whoever could be found, as well as whatever disease they might be carrying. On March 23rd, 1930, the young man introduced at the beginning of our story lies bleeding to death from self-inflicted wounds in an attempt to end his own life. Medical staff were able to suture his wounds and apply a dressing. However, the young engineer had begun to succumb to hypovolemic shock. When hypovolemic shock occurs, tissue begins to die and organ systems shut down. At first, the body will compensate. Heart rate increases, peripheral vessels constrict, and the heart will pump with greater force. This is the sympathetic nervous system at work. By the time 30% of blood has been lost, however, the initial compensation is not enough, and the patient will move into a hypovolemic state. Oxygen cannot get to the organs fast enough to meet their demands. Cells change to anaerobic metabolism, meaning without oxygen. This is a far less efficient way of creating energy and creates lactic acid as a byproduct and leads to a metabolic acidosis. Organs, furthest away from the heart, lungs, and brain, begin to shut down. Dr. Yudin had tried all the methods at his disposal. He was out of options. To save the young patient, he headed to the next room where a deceased 6-year-old lay after being hit by a bus earlier in the day. The young and old man both had the same blood type. Thinking back to the lecture from V.N. Shamov, Dr. Yudin had decided to act. With little time, Dr. Yudin saw no ethical dilemma. From his point of view, if the experiment failed, it would only have delayed the death of the young man who had initially sought it. Without the blood, he was dead anyway. Yudin painted the dead man in antiseptic and began to cut him open. Finding the inferior vena cava, he inserted a needle. Next, he attached a syringe as he pulled back on the plunger. The vein collapsed. Yudin let out an exacerbated sigh of frustration. Not to be deterred, the nurses raised the dead man's feet and arms, which might have looked like a scene from Weekend at Bernie's. As well as this, the nurses began chest compressions and massaging of the limbs. All of these actions combined, and slowly, the dead man's veins and arteries began to slowly repressurize. Yudin was able to withdraw more blood. As the pioneering doctor withdrew syringe after syringe, a nurse burst into the room. The young engineer was showing signs of imminent death. With all but the central pulses barely palpable and pupils sluggish to react, Yudin didn't hesitate. Using the radial vein of the young patient, he injected the blood via a syringe. At first, 250 milliliters, then another 150 milliliters. The modern bag of blood contains approximately 250 mils. The peripheral pulses began to return. Breathing reverted from shallow respirations to deep ones. The young patient regained consciousness. There were no transfusion reactions reported. This was the first time a dead patient would give blood to the living. The young engineer would be discharged 2 days later. In the days that followed, Yudin transfused 6 more patients with corpse blood for illnesses ranging from cancer to amputation. This breakthrough saw authorities grant Yudin permission from the state attorney to continue his experiments. If there was a sudden death in Moscow, the body was hurried via ambulance to Yudin's hospital, where he would begin to collect and transfuse the blood. With such a high supply, he began to store a small amount in refrigeration. The bodies that had been collected from were autopsied to rule out any signs of infectious disease. His donors had to have died from a sudden death, whether it be a heart attack, tram accident, murder, it didn't matter. The important part was that they had died suddenly, as those victims' blood would remain liquefied, whereas the blood of people suffering from prolonged deaths would clot and not be useful. It would later be discovered that only in the instance of a sudden death, the body would release enzymes which dissolve blood clots. In 1938, during the prelude to World War II, 2,500 people had been transfused with the blood of the dead. 125 of them would have non-fatal transfusion reactions. These were things like fevers and chills. Doctors in Germany and England, while intrigued by the idea, did not test it for themselves due to the stigma surrounding the process. However, this stigma did not extend across the pond. When a Chicago hospital began 35 experimental cadaver blood donations in 1935. This work was kept secret, with patients and families never knowing what had been done. Few records survive, and the experiments were only ever revealed publicly when a doctor who had participated wrote a 1970 journal article detailing the safety of the experimental use of cadaver blood. The USA briefly experimented with the procedure again in 1964 when Dr. Jack Kevorkian conducted a small-scale study at a Michigan hospital, finding it safe. Back in Moscow, the Soviets had begun to collect blood from placentas, as well as donors who walked in off the street, as opposed to being brought in by ambulance. With increased supply from these walk-ins, they began to stockpile increasing amounts, and using techniques such as sodium citrate to stop the blood from clotting, as well as refrigeration, the USSR would establish 60 large donation and storage centres, with 500 satellite facilities by the mid-1930s. As live humans took up the cause of donation, the need for cadaver blood fell. The blood was stored in cans and could be moved quickly to any part of the Soviets' vast swaths of territory. By 1937, over 10,000 quarts of blood had been stored or transfused. 10,000 quarts is equivalent to 10,000 litres. Through boldness, courage, and experimentation, the Soviets had achieved a world first. But with World War II on the horizon, the efforts of storing blood were just getting started. Next on Blood Stories, we look at the role blood played in the Allies' efforts to win World War II, as well as what the Axis did, which could have cost them the war. And I just want to say thank you so much for watching. Anyone watching, I really appreciate it. If you could give a like or a subscribe just to help encouragement of more of these kinds of videos, that would be really handy, but if not, that's totally cool as well. I just appreciate you being here and giving your time to watch this. So yeah, you take it easy and have a great day. Okay, thank you and catch you next time.